Thank you for joining us for the webinar today on Trusted Voices, how faith leaders can communicate evidence-based family planning information. It's my pleasure to be with you today. My name is Nagwa. And I'll be your moderator for today. Thank you very much for joining us from different parts of the world. We have here, as I told you, 58 countries, which is amazing. Thank you for joining. We know that communities listen to trusted leaders when making personal decisions, including choices about their reproductive health and planning their families. With 85% of the world population belonging to faith tradition, religious and lay leaders are often very influential, making it extremely important that they have accurate evidence-based information to share with the communities. This webinar is hosted by the International Conference on Family Planning, ICFP, Faith Subcommittee. In celebration of the World Religion Day, today's discussion will explore examples of equipping religious leaders with facts about family planning and share strategies, challenges, and tools to help faith actors protect the health of their communities. Our first speaker is Reverend Puleng Mkhatshwa. She is a development officer for UN Women South Africa. She has over 20 years of experience with international NGOs, UN agencies, and faith-based organizations. She has expertise in gender-based violence, livelihood programs, and evidence-based advocacy, coupled with a deep passion for issues surrounding children, gender, and health. She holds a Master in Development Studies and the honor in the New Testament and Early Christian Studies. As a former gender program coordinator for the Evangelical Lutheran Church in Southern Africa, she led interventions addressing gender-based violence across multiple countries. Over to you, Reverend Mkhatshwa.
Good afternoon, good morning, good day, good evening, ladies and gentlemen. Thank you very much for inviting me to this important convention today. In South Africa, on the 26th of December, 2024, last year, we woke up to great news of babies born on Christmas Day, a testament to this miracle of life. Among these babies, or among these new mothers, was a 13-year-old from Limpopo province. That's where our challenges begin now. And a 15-year-old from KwaZulu-Natal were among the mothers, the young mothers as well. A 16-year-old from the Northwest province. This meant an ongoing crisis of teenage pregnancy in South Africa. In South Africa, in 2024 alone, more than 122,000 teenagers gave birth. Amongst those, 2,716 were girls between 10 and 14 years old, and 578 were teenagers between the ages 15 to 19 years old. These young women are now facing parenthood whilst they are still children themselves. Why faith leaders matter in the family planning? Faith leaders, as we all know, they hold a significant influence in the communities. We are able to shape values, and we are able to shape values and behaviors, in particular of these young women and men in our society. Faith leaders' voices can bridge the gap between faith and health education. by combating faith with evidence-based knowledge and approaches. We can empower families to make informed decisions on family planning. Proverbs chapter 11, verse 14 tells us that when there is no guidance, people fall, but in abundance of counselors, there is safety. And therefore, my dear brothers and sisters in Christ, when we are addressing teenage pregnancy and family planning, we need to align with our moral responsibility to nature and to guide the next generation. In South Africa, 1 in 3 young women are teenage mothers before they turn 20. Next slide, please. Teenage pregnancy contributes to various factors such as school dropouts. It contributes to poverty. It also contributes to health complications. The root causes thereof are the lack of education, peer pressure, gender-based violence, and inadequate access to family planning resources. Teenage pregnancy increases the dependency, and it strains healthcare systems. It limits the opportunities for the young mothers. Therefore, evidence-based family planning helps families to determine the number and the timing of children. And it is supported by if it's supported by scientific research for health and socio-economic benefits, we will be able to ensure that these young mothers are receiving the evidence-based family planning through us as faith leaders, not forgetting the World Health Organization standards of respecting informed consent and accessibility, making this family planning accessible. And we should also bear in mind the cultural sensitivity. Next slide, please. As faith leaders, we have a role to ensure that sexual rights and reproductive health rights are simplified for teenagers. They should be explained such that it makes sense to them. It shouldn't become like this science that they cannot understand or these big words that they cannot relate. It should be explained to them in a relatable terms for their age. We as faith leaders can use faith-aligned narratives in explaining contraception and family planning. We can also engage teenagers in social media platforms through question and answer sessions. We can also use real-life stories to convey messages of family planning. We can also empower parents and encourage them to have open faith-based discussions in the comfort of their own homes, knowing that if the conversation starts in church, it will be easier for parents to take it home. Next slide, please. We can look at practical faith-based approaches that as faith leaders we can implement to ensure that these messages of family planning, of contraceptive, of sexual right is received well by these young mothers. Faith leaders can use the pulpit as a powerful tool to relay positive messages on family planning. We can use workshops and Bible studies to teach teenagers about self-worth and God's plan for their lives. As faith leaders, we can also organize youth-focused events for teenagers. We can also invite health professionals as guest speakers in our churches and also in our youth activities. We can also encourage parent-teen dialogues, the intergenerational conversations, so that and ensure that as the church we create a safe space where parents and teenagers or young men and women can engage freely on issues of family planning and contraceptive. Next slide, please. Addressing issues of family planning and contraceptions comes with barriers. There are cultural myths that as faith leaders, we also perpetuate. So we need to align our teaching such that it is easier for teenagers to engage in the context of the church to talk about issues of contraception and family planning. We need to normalize the reproductive health discussions in sermons and in youth gatherings. I know sometimes it gets difficult for faith leaders to talk about issues of reproductive health with young men and young women. However, if we are certain that we want to build a strong generation of independent young men and women, the issues of sexual reproductive health should be normalized. And we also need to frame family planning as an act of love. We should also ensure that it is a responsible living for young women. And lastly, we should ensure that we advocate for healthcare services for underserved communities. We can also try, we did during the HIV period, to have condoms in our churches, so we can encourage the healthcare workers to ensure that contraceptives are available in the church. The last slide, please. The call to action. As faith leaders, we should embrace our role as trusted voices for truth and love. As faith leaders, we need to commit to educating and empowering our communities. We need to educate ourselves to understand the science and the science behind family planning. And through collaboration and partnerships, we can help healthcare experts to come to the churches and address these young men and women. We can also open our church doors to empower communities to embrace evidence-based practices. We can have clinics in our churches. We can have mobile clinics coming to our churches on certain days. We can also create relatable messages tailored to youth concerns and aspirations. And lastly, we can use our platforms to communicate and to embrace evidence-based practices. Thank you, Program Director.
Yeah. Thank you, Reverend Mkhatshwa, for your insights on the moral and ethical authority for faith leaders in their communities in combining faith with evidence-based knowledge, highlighting the importance of communication strategies and addressing barriers, then having actions toward family planning issues. Thank you so much. Now, let's move to our next speaker, which is Krishal Fernal. Krishal is the Philippine Director of Health Operation for International Care Ministries, ICM. She is a registered nurse and began working for ICM 11 years ago as a health implementer in the community. She worked alongside the local health unit as well as ICM partner pastors in the communities. One of ICM health programs is screening women of reproductive age who are not using family planning, educating them about the different methods to time and space pregnancies, and referring them to local health facilities for family planning use. Over to you, Krisha.
Thank you. Hi, everyone. Good day. Today, I will be sharing about International Care Ministries, or ICM's Family Planning Initiative, in partnership with the local faith leaders. But before that, let me share with you how and with whom ICM delivers its programs in the communities. Next. In the Philippines, ICM operates in 13 base locations. If we zoom in to each of these base locations, there are ICM partner churches, which are represented by these dots. Now, most families that ICM serve live in remote villages, dense urban slums, and in shanties over water's edge. And one thing that most of these areas have in common is the presence of a church. ICM has a network of 20,000 faith leaders of different denominations, and through this network, over 2 million people have experienced Transform's positive impact. Next. Transform is ICM's holistic education program that builds capacity for real change in ultra poor families. For 4 months, small local churches host weekly hands-on transform training in their communities, joined by 30 participants. These participants are not members of the local church hosting the training. The curriculum focuses on 4 key topics and led by ICM specialists. First, we have heart, which is building hope, both aspirational and spiritual, and is led by the local pastor. We also have opportunity for growing sustainable income and savings, and is led by ICM's livelihood trainer. Then we have physical, which is improving family health, and is led by ICM's health trainer. And finally, education, which is launching school-ready learners, led by ICM's education trainer. Now, a selected participant shadows the ICM staff to learn and help lead the lessons. These new leaders become the in-community champions of their areas once Transform ends. Next. ICM's family planning intervention happens within the 4-month Transform training and another continuing interventions after that. In Transform, ICM's health trainer is implementing the intervention to the training participants. Here, ICM's health trainers use screening and referral forms, as well as family planning leaflets and education manuals. Once the 4-month Transform has ended, the selected participant who shadowed the ICM health trainer during Transform became the community's health champion and continued the implementation using what we called the Flourish app in their phones. This app contains all the needed information and resources by the health champion in delivering the services to the community, including family planning. Next. Now, in Transform, ICM's health trainer delivers family planning lessons, which includes importance of family planning, different methods of family planning, and where to get further information and support. Understanding the role that the parents play in sex education for their children is also included in this lesson. As the ICM health trainer delivers these lessons, the local pastor is present during these lessons and interventions. The pastor not only endorses these lessons, but also learns from them that he or she can also share to his or her own congregation and even to the participants. Besides the health lessons, participants are referred to the local health unit who are interested in family planning and those who have issues with their current family planning. They will then be followed up weekly after the referrals if they have visited the local health unit and if their issues are resolved. The health trainer continues to provide ongoing support and education for current and prospective family planning users together with the local pastor. These interventions are ongoing until the end of Transform. Next. After the 4-month transform, the selected participant who becomes the community's health champion continues the health intervention. This health champion functions in the community still in partnership with the community's faith leader or pastor. Using the Flourish app or their phones, community health champions or CHCs educate women of reproductive age about family planning and its importance, as well as the types of family planning. The CHC will then ask the household who are not yet using family planning method if they are interested to use one, and they will be referred to the local health unit. Those who are already using family planning method and with issues about their family planning method, they are also being referred to the local health unit. The CHC will follow up the referred household within a month and check if they are now using the family planning method and or if their issues are already resolved. Next. Some of the challenges that we encounter during these interventions are access to local health units. Some households who are currently not using any family planning method or unable to receive it because they could not access the health unit due to its distance. This also includes the availability of the preferred method. Some family planning methods preferred by the participants are not available in their local health unit. What we also noticed is the less involvement of the husband in the family planning decision making. That is why mostly it is the wife who decides and chooses the method. Majority of the people in the Philippines are Catholic. Surprisingly, we did not encounter any participant refusing family planning due to their religion. Next. As a result, we were able to screen 34,445 women of reproductive age, and 14% of them have unmet family planning needs, meaning they are not yet using any family planning method or are not satisfied with the method that they are using. After referral to the local health unit, 63% have their family planning needs met, and around 700 are still to be followed up. Next. Here are the distribution of needs met and needs unmet in each of the base locations where ICM is located, as well as those that have not yet visited the local health unit. Next. Moreover, here are the responses we have gathered from those we have screened. Here are the types of family planning most of our participants are currently using. 47% are using pills, around 2% are using implants, then injections and natural family planning methods. Some of them expressed a desire to change their family planning method. And here are the methods that they prefer. Still, mostly, they prefer to use pills. Then, some prefer the natural family planning method, as well as implants and injectables, respectively. Next. Finally, after their visit to the local health unit, here are the methods that they actually used. Almost half of them received pills. Then some of them also used natural family planning method, as well as implants and injectables. Now that is ICM's family planning intervention together with our local faith leaders. Thank you.
Thank you so much, Krishel, for your insights on the holistic education program that is focused on poor families. Your whole program gives us all hope that family planning efforts and interventions will be flourish and having great impact in Philippines regarding family planning issues. Thank you very much. Now, we will move with our third speaker, Sheikh Salio Mbake. Sheikh Mbake is president and CEO of Cadre de Religious pour la Santé et le Développement. Excuse my French. CRSD is in Senegal. CRSD is a Senegalese interfaith organization that brings together all religious families, Islamic associations, and as well as Catholic and Lutheran churches in Senegal. Created in 2014, CRSD support the Ministry of Health and Social Action in the implementation of the National Strategy Plan for family planning. Sheikh Mbake is also an international consultant on religion, peace, and development, and a member on ICFP Faith Subcommittee and the Faith Working Group of Family Planning 2030. Over to you, Sheikh Mbake.
Hello, everyone. The Cadre de Religieux pour la Santé et le Développement stands for Religious Group on Health and Development, and it was created back in 2014. And it amalgamates the major religious families. We have what we call here the Sufi Islam in Senegal, which is the inward mystical looking of Islam. In other words, it's a very tolerant doctrine of Islam based on peace and harmony. It also includes, Islamic associations as well as the Catholic Church and Lutheran churches in Senegal. In other words, it is the whole spectrum of religion working together in this NGO for peace and development with a focus on family planning since we started. And we've been doing this with the Ministry of Health. And the idea was to accompany the Ministry of Health in the implementation of the family planning program because they were having many obstacles, socio-cultural barriers, obstacles that was impeding the progress of family planning program. The next slide, please. When we started, the figures were about family planning were something like CPR was at 20% in Senegal. And we carried with the partner a study comparing Senegal CPR rate with other Muslim majority countries such as Morocco. Morocco was at 67%. Iran was at 74%, Indonesia were at 60%, while Saudi Arabia was at 32%. Just to tell you how Senegal was lagging behind compared to these other major Muslim majority countries. Child mortality rate was at 75 out of 1,000 of every 5-year-old infant. Mother's mortality rate was at 392 out of 100,000 births. So this is when we started. Now, the current situation is CPR is nearly 27%. Mother's mortality rate has gone down to 285 for every 100,000 births. And the infant mortality has dropped to 42%. These are the figures just to show and try to see how the contribution of religious leaders has contributed has made it possible to, increase the CPR and also reduce the child and mother's mortality rate in the country. What was the strategies that we used? We used what we call the courtesy visits. Why courtesy visits to senior most religious leaders? Because the way Senegal is defined, the religion is defined here, senior most religious leaders have a big influence on every sector of society. People listen to religious leaders, especially those who are high-ranking religious leaders. So the strategy we used in the first place was to visit these senior most religious leaders, what we call them khalifs here, who are at the head of these families, to inform them of our initiative and also get their backing and blessing for the success of our project. And then obviously, as religious leaders, there's nothing we can do without using religious arguments, to advance what we are saying. So we went and developed religious argumentation, based on Islamic teachings and also Christian teachings, that are in favor of family planning. And then we started disseminated this around the country, covering the 14 regions of the countries since we started until now. We also conducted some capacity building for faith actors, obviously at the beginning, because the faith actors who are involved in the project did not have any idea about family planning. So the project actually prompted us to go and research what our religion is saying about family planning. And then that is what made us possible for us to come up with these arguments, religious arguments in favor of family planning. So the dissemination covered, the training covered religious leaders, but also, what we call Bajanigor, which are, women leaders who have a lot of influence on people, journalists, and you name it. And then the next slide, please. Next slide, please. Then we moved to, obviously at the beginning, the focus was on legally married couples. Obviously, religious leaders cannot talk about family planning outside marriage, because then if we do so, we will have problems. But the issue of the youth was so crucial as well, because we knew that there's a drama behind that, and but we had to adopt a very prudent strategy to address the youth issue. Since we cannot talk about sex out of marriage, we have to find a strategy to address the youth issue. We knew that there was a lot of drama behind it, and it was not because we were in denial, but we needed time, and to find a way to address the issue. So that's why we came up with also another argumentation for the youth and adolescents' health, which also we started disseminating throughout the media, raising awareness of women, women leaders, all these, the Quranic teachers and all that, imams and all those through forums, etc., etc. Not only for birth spacing, promoting birth spacing among young people, but also talking about youth and adolescent health. This also included some exchange visits to countries in the sub-region. Next slide, please. So the arguments are, as I say, homemade. Homemade means the Senegalese scholars who have come up with it, with contributions from our religious leaders, contextualizing it also with the Senegalese context and culture. We also came up with multimedia presentations with our partner PRB, with USAID funding, called Engage. The Engage process was also some multimedia tools that gathered scientific data with religious messaging. We know that data is important, and it has to accompany religious messaging for it to reach the purpose. So Engage was disseminated in Senegal. There was two types. One is tailored to Senegal, and other, which was regional, that covered also Senegal, Guinea, Mali, and Mauritania. So this is this one was called Sahel Engage, that dealt also with family planning, with also FGM, child marriage, and so on. We also developed some sermon guides, specifically on family planning, that we've been disseminating. Next slide, please. Next. So how does the legislature leverage social media and online platform to engage young people and adolescents? We know that to reach out to the youth, we need to use these platforms, these social media platform to reach out to them. That was very important. So as we hire an expert to do that. So through conferences via community radio, TV, Facebook, live, so that it can the communities, the youth, young communities can access it. Next, please. Next slide, please. So by collaborating with religious influencers and figures, respected people, because young people respect religious leaders. So we think that by this collaboration, this dialogue between the intergenerational dialogue between youth and religious leaders can really reinforce the messaging. Next, please. Next slide. So we said we produce videos, broadcasts, blogs, and articles. We name it. Everything that has to do with this media, with the platforms, we do not leave out anything. We conducted a digital campaign specifically for this, like promoting youth and adolescents' health and other activities related to family planning in general, using this platform, which proved to be very, very efficient. Next, please. Next slide. Yes, so the group discussions on Facebook, WhatsApp, Discord, allow young people to chat, ask questions, because they interact with us directly through these platforms, and in a very comfortable and a very relaxing and very confident way. We found that it was a very good strategy to engage with the youth, religious leaders, and the youth. Next, please. So to increase the visibility of the post, we use popular hashtags, create challenging messages related to religious practices or moral values that can lead to behavioral changes. Next, please. Yes, CR is developing digital applications to facilitate interaction between young people and religious leaders. We keep on developing more and more tools. We keep on modernizing things so that the messaging and the communication, can improve. And can be, youth, young people friendly. Next. Next, please. So all these are surveys and questions and answers. That interactive stories on Instagram.
Yeah, there is also resources in the chat box. You can check it until we get back to Check Mbeke. Okay, so I think it's connection problem with Check Mbeke. We were almost finished the slides. So when we get him back, I think we can ask all questions we need to clarify more information. Now, it's Q&A part. Okay, so I have, I think, quite good amount of questions. Okay, I will start. I have first question from Tunde in Nigeria. He said, I think it's not just culture, myth that should be debunked. What of some preserved scripture barriers to family planning? These should be addressed head on. Do our speaker have any comments on preserved barriers to family planning from the Christian context in South Africa, predominantly Catholic context in the Philippines, and Islamic religious texts? Yeah, I think this is a good question for our speakers. Who can start to answer it?
Can I have the platform?
Yes, of course, Reverend. Go ahead.
Of course, Tunde, we need to debunk also faith myths. As I've said in my presentation, that we can use the very same Bible that we have as our tool and conduct biblical Bible studies. We can also encourage the workshops where we teach about family planning using the Bible, like we are also using with other, when we are addressing other issues of sexual reproductive health and rights. Thank you.
Thank you, Reverend. And then I think this question is still having some more areas regarding Philippines. So, Krishal, if you please, would you cover the Catholic context in Philippines regarding this question, please?
Thank you. Yes. Here in the Philippines, the Catholic Church usually does not or does not recommend the use of a natural family planning, because they would say that it is against the natural law of the Lord. But however, a lot of educational resources have now been released by or is still circulating and is also being encouraged by the the Philippines Department of Health, in terms of educating everyone on the proper use of family planning method. That is why maybe the reason why in our communities where we serve the ultra poor, we don't usually get any restrictions in terms of the use of family planning methods, in the use of family planning methods in our community, even though most of the people we serve, or most of the participants that we serve in the community, are Catholic.
Okay, great. Thank you, Krishal. Now, Chikembake, this part of the question is for you. What are the family planning barriers from the Islamic context?
Thank you, and sorry for the interruption. You know, my connection, I'm actually at a hotel. Sometimes it's a bit tricky.
We can cover
yes.
in these questions.
Yes, barriers from scriptures, Islamic scriptures. There's 3 principles in Islamic teaching that are fundamental in human relations, defining human relations. The first one is, necessity. Necessity always becomes law. What does that mean? That means that, for example, anything that is threatening life should be dealt with. Even if you are a Muslim and, alcohol is prohibited in Islam, but if you are in a situation whereby if you don't drink alcohol, you die, then drinking alcohol becomes an obligation, you see, because life is sacred. Sanctity of life, dominates anything. So that means necessity becomes law. That means family planning, if the life of the woman, of the child is threatened, then family planning becomes law anyway. That's the teaching. The other one is facilitate, do not make difficult. It's also another principle. And the other one is make everything easy for human life, spiritually, physically, all that. So Islam does not prohibit anything that is for the well-being of the human person, right? Now, interpretations are different. What we are saying is that what Islam is against is birth limitation, but not birth spacing. Spacing birth to reduce mother and child mortality is perfectly allowed, and it is proved by Quranic verses and hadith and so on. Scholars have backed it. So it is the interpretation of those who are against family planning or detractors of family planning who give baseless arguments that Islam is against it. That is the problem. But Islam itself is not against anything that is, supposed to save lives and contribute to the harmony and the well-being of the person.
Thank you, Chekembeke, for covering this part. Now I have second question to Krishel from Halawiya. She said, how can parents from the villages be empowered about the importance of family planning? Because some of them were not educated, hence they are against the use. So how can you raise their awareness? How can you convince them, especially people in villages? Over to you,
Thank
Krish.
you. Thank you. That is why during our transform training in the community, we allot a specific time where we educate the parents or the people in the community or those participants that are joining us about the importance of family planning, what are the types of family planning, addressing addressing the myths about the family planning that we have here in the Philippines. And besides that, after that intervention that we have in the community for over 4 months, we do an active education to the different houses in the community where our health champion purposefully go to the households and give them education about family planning.
Thank you, Krishel. I have another question here, maybe for Reverend Mkhatshwa from Jonas. Jonas say, in our region, family planning has divided the churches because there are no biblical legacies on family planning. Do you also face this kind of challenge in your context? This is the first question for Jonas. If so, what are the responses, strategies you have given to overcome these challenges? I think Jonas mean that different denomination in the church having different issues regarding family planning. So, Reverend Mkhatshwa, would you please proceed for this one?
Yes, thank you. We can, as faith leaders, use the scriptures themselves. We can conduct contextual Bible studies. We can have storytellers to come tell their stories, because there are there are issues that affect especially the young women who become mothers at a young age. Some of these young women who are willing to come tell their stories, they can be invited in the church setting to come and tell their stories about the challenges they face as being young mothers. So that is one of the things that we can, the tools that we have as faith leaders. And if us as faith leaders speak clearly about family planning using scriptures like the Proverbs chapter 2, 24 verse 3 to 4, 1 Corinthians chapter 14 to 14, conduct Bible studies on those texts and using practical example, I think we'll be able to overcome the fears and the challenges. And also it's because people have those challenges because of the lack of knowledge. So if we empower them through knowledge and through evidence-based family planning, I'm sure we can come to agreement with our congregants. Thank you.
Thank you, Reverend Mkhatshwa. Chekembeke, there is a question to you from Tendai. In the Christian arm of CRSD, do you discuss family planning during pre-marital phase? Sorry, go to back to the question. Yes. Yeah, he's asking you regarding the Christian arm or the Christian service in the CRSD. Do you discuss family planning during pre-marital counseling sessions? Are you having this information?
Thank you. I think we are an interfaith organization, and every actor, everybody who is with CRSD follows the strategy, the global strategy we use. So we encourage everybody to use their scriptures to promote family planning. In also in religious ceremonies, that goes from sermons on Fridays or at mosques for the Muslims to churches to Sunday church sessions and celebration of marriages, etc., etc. I cannot come with figures or concrete information about that, but we really encourage everybody to talk about family planning every time they have a gathering, a religious gathering, so that it becomes also a routine. People get used to it, and the more they hear about it, the more it will become a habit. Okay, thank you.
Thank you very much, Kembake. I have another question from Ola Torreira. I think this is for everyone. How can the men be involved in family planning? Most women are left to decide, and their left to decide family planning issues, and their husband at time go against the idea, leaving women to make that decision alone, or at sometimes maybe they go in conflict regarding this issue. So how could we involve men in family planning? This is for all the participants who can proceed. Sorry, our speakers. Chicken Baké, you want to go first? Yeah,
Yes,
please.
I think here in Senegal, the biggest challenge was to get men allow their women to do family planning, to take contraceptives. So the strategy the ministry has been using is to create demand, and that's actually where us religious leaders can contribute. We're not a service provider. We cannot. We're not here to provide service. We're here to create the demand by sensitizing people, especially men. And I think we've succeeded in that because if you look at our figures, men's participation, it has really grown, incredibly since we started until up to now. But obviously, it has to be a gradual, a prudent approach. You cannot just come abruptly and tell men, allow your women to do, take contraceptives. You have to give solid religious arguments to that. But the involvement, the actors being religious leaders themselves and doing the sensitization has helped men who were reluctant before to really allow their women to take contraceptives. So demand creation among men is one of the strategies we've used. Thank you.
Thank you, Chicken Baké. Reverend Mkhatshwa or Krishal, and if you would also proceed for the same question.
Yes. For any issues that involve both genders, men and women, as faith leaders, we need to address them equally so, because there's no child without a man and there's no child without a woman. So if we conduct Bible studies, we should include men so that they get also empowered in terms of making informed decisions in the timing of their children, in terms of the number of children that they want in a family. And the same applies to the teenagers, the young mothers and the young fathers, because that affects not only them, it also affects the community and it affects the family. So when we do any intervention, we should include both genders, men and women. Thank you.
Yeah, I agree with that. In our context, I think for us to involve the men in the family is to include them during health education. Uh, Through including them through health education, they will be able to know and understand what family planning is, how important it is to the health of their wives or to the women in the family, and also if they will be included into the discussion and they will know the types of family planning that's available, they can also be given that decision to be involved in the decision making, family planning decision making of the family. Thank you.
Thank you, dear Krishal. Thank you for all speakers highlighting that gender equality is really important in addressing family planning issues. Thank you for that. We have another question from Adam in Ethiopia. How can religious individuals and leaders incorporate family planning into the practice? Is this any alignment with the all of God and who ultimately bestow children upon a family? Okay, how could we? Yeah, I think this question for all also speakers. Would you proceed how religious leaders go and put family planning in practice using the faith or religion? So, Reverend Mkhatshwa, do you have answer for this?
My apologies, I missed the question. Please repeat the question.
Okay, how can religious leaders incorporate family planning into their practices? So, how could you address this into your practices? Is this any alignment with the will of God and ultimately toward children upon a family? How you link these between the family planning efforts and Christian faith?
It is very much linked because as faith leaders, we need to try and normalize talking about family planning in our pulpit, as I said in my presentation, because if we fail to do that as the trusted voices, people won't know, and people might have that stigma of talking about faith leader, about family planning in the religious setting. So through our sermons as religious leaders, through our Bible studies, like I said, through contextual Bible studies, where we use the word of God and talk about family planning at the same time, so that it's known that this is not a stigma. Family planning is also part of our nature, and it's God's will as well. We have to have family planning. We have to combat poverty, because family, another root causes of another challenge of family planning, it's that it perpetuates poverty by young women and families which have a lot of children and they cannot take care of it. So we should find a way of addressing those challenges through the sermons, through the Bible studies, through the conversation that we can have intergenerationally. Because like I've said, that in South Africa, we're struggling with the issue of teenage pregnancies. So we should also normalize that from our churches as we conduct the penitential classes. It should stop as being the ABCD that is known. We should also include issues that are affecting the social issues that are affecting our communities, like family planning, for example. HIV, we do, gender-based violence, we do. Why not family planning? Thank you.
Thank you, Reverend Mkhatshwa. Yeah, Chicken Bakke, do you have also insights in this question regarding the alignment between the family planning and God's will toward the family planning? Is it aligned?
Yeah, I mean, I think God's will is part of is the faith. You know, everything is decided by God. But what we call tawakkul, like attributing everything to God, is an obligation. But you should not God doesn't say just attribute everything that happens to you, good or bad, to me, and just, cross your hands and wait. Wait for the bad thing to happen to you, wait for the good thing to happen to you. No, you have to endeavor. You have to take action to prevent bad things from happening to you, and it is well documented, well argumented in religion, do not work towards danger. Prevent yourself from danger. So if family planning is life-threatening to the mother and the child, you have to do it, It's not God's will. You cannot attribute to God's will if the child dies or the mother dies and you do not take the necessary action that God told you to take to prevent the mother or the child from dying because of family planning, consequences. So yes, God's will is there because, but take the necessary measures, the necessary action for to prevent yourself from illness and from bad things and all that. So it aligns very well. It's just that God's will goes also with action. Take the action, and then God will help you to achieve your goal. But if you just stay and expose yourself to danger, actually it becomes a sin because you're almost committing suicide.
Correct. Thank you,
Yeah.
Chicken. I have another question for our speakers from Domenico. Excellent discussion. How is community success reflected into successful engagement of key decision makers from government and parliaments? How do you tailor advocacy messaging and political engagement to advance implementation, national policy and legislation, and international commitments? So here's a question about advocacy regarding family planning, how to engage government and decision makers, parliament. So this is open question for all our speakers.
I can start if you want. As our strategy was always to accompany government program on family planning, because the idea was that government says we need you religious leaders to help us reach out to the community. So you need religious messaging to convince communities. So that's where we actually get involved in government. So we are partnering with them, with the Ministry of Health, and I think they are very happy about that partnership because it's a very specific partnership on a very specific program, and they found out, they identified the need for religious voices, to accompany the program so that people accept the family planning programs. Parliament and all that, we haven't had the chance yet to get into Parliament. We are, extending our relationship with other ministries, apart from family planning, but also maybe related to family planning and, women in general, Ministry of Women, Ministry of Environment, and Ministry of Education, all those ministries. And we are aiming to also go to Parliament because Parliament is where also I think religious leaders can have a voice. Because Parliament is supposed to be representing the people. So maybe we can, I think parliamentarians will listen to religious leaders if we tell them that, family planning is an important component of community programs and all that. Thank you.
Huge. Okay. Yeah, Krishal, would you please
Sure.
add to this
And
one?
in addition to that, here in the Philippines, the advocacy on family planning is really strong. Government and private agencies really work together to promote family planning, especially in the communities. So usually it is always led by the Department of Health in the country, and its voice on family planning is really strong. That is why we can see collaborations of government and non-government organizations working together to promote family planning, especially in the local communities, especially in those far-flung areas where it is not usually reached by a lot of people. I think probably the only thing that we need to have focus more on here in our country is probably the resources, especially the availability of the different family planning methods in the local health unit. Thank you.
Thank you, Grishel. Yeah, I think here in the chat box you can find resources regarding advocacy. I mean, regarding this question, you will find the tool. It's a family planning advocacy through the religious leaders, a guide for communities. It's a helpful tool to support any communities advocating for family planning from religious perspective. Advice to have this link. Okay, let's go to the next question. Next question to Cheikh Mbeke. What about family planning for young women? I know you, Cheikh Mbeke, mentioned about child spacing versus birth stopping. How do we address the issue for our young women and faith leaders?
You mean unmarried young women or married young women?
I'm not sure this is a written question.
Obviously, if it is for,
It's talking about young women. If I'm not sure, maybe the recently married women. Do you have?
Okay. In any event, if it is a young woman, married young women, there's no problem with religion. Obviously, as I said, the problem we have is to talk explicitly about family planning, outside marriage. Nonetheless, the youth issue, as I said before, we've been dwelling around it and all that, but it's not easy for religious leaders to get involved in family planning conversation that is talking about the youth who are not married. But it doesn't mean that we're in denial. So the approach we used was to develop an argumentation that talks about youth health in general, youth well-being in general. But that also deals with, includes something like abstinence, obviously, responsibility about your own health, abstaining from taking drugs and so on and so forth. But I think it is a dialogue that can lead to that, but a sincere dialogue, where everybody also respect their own sphere and their own limitations. Religious leaders have limitations in their conversation. Even though we want to address the youth, who are maybe practicing sex outside marriage, but we need to be very careful about the messaging about that. So the messaging, I think the strategy is to convince the youth that they have to adopt a responsible behavior, including abstinence and responsibility and so on and so forth. But obviously, that is an implicit way. But explicitly, it's very hard for religious leaders to talk about family planning outside marriage.
Thank you, Cheikh Mbeke. But I think you are breaking this taboo now, and you are going in this area and having lots of effort regarding this with faith actors and faith leaders. Thank you for that. I have another question from Ishaya. How do we handle offering of contraceptives to adolescents, girls, and young women, between bracket unmarried, especially where we are sure they are sexually active? It's a very sensitive question. Yeah, how we have this knowledge, information, and offering. I mean, it's a practical issue regarding family planning. How we can offer contraceptives to them. At the same time, we know they are unmarried, but they are active sexually.
This question should not be asked to a religious person, but to a health provider. You know, we work with the midwife, you know, with the midwives in general. But they what do they say if a young person, a girl, for example, unmarried or unmarried couple comes to them and tell them, we want you to give us family planning services. So first of all, because they are themselves, this health personnel, they have religious convictions. They will say, we try to convince them to wait until they get married before engaging into sex. But obviously, at the same time, they had sworn, it's there under oath, to provide services, family planning services to anybody who needs them. So they are in that dilemma. But obviously, this question is for health providers, not for religious leaders will tell you, don't offer, you know. So if maybe somebody else can have an answer to that, but that's what I can say.
Can I please add, colleagues?
Please, go ahead, please.
Yes, I think we should, the issue of stigmatizing between married and unmarried women, I think it's a challenge here. Because family planning is not only for women. Family planning is for both men and women. So we should approach it in that way. And also, we also as faith leaders have a role to play in aligning our narratives in terms of explaining the contraceptives and family planning. We cannot just leave it to health professionals. So if it starts with us as faith leaders, as people that they trust, and then we talk freely and openly about family planning, I'm sure we would, in the near future, not talking about family planning, because we would all be empowered and be able to make informed decisions, whether married or unmarried. Thank you.
You, Reverend Mkhatshwa. Yeah, I have a question, I think, to Krishel from Nelly. What modalities can be adapted to get the information to reach the uneducated in the remote villages? Again, people in villages, what modalities you can adapt to get them the information? Maybe the educational barriers or something. How would you do in these situations?
Thank you. Besides the health education or the health lessons that we provide the communities, we would usually hand out leaflets or pamphlets that have good graphical illustrations about different types of family planning methods, its importance, why they need to use family planning methods. And these leaflets or these pamphlets that we are using, we have also adapted this from the government, since they encourage all the government and non-government agencies advocating family planning to share those pamphlets or those leaflets. And not only our participants benefits from those pamphlets, but as they bring it home, they can be able to share it with their kids, with their family, and even to their neighbors. Thank you.
Thank you, Krishel. I think we're going to our end. Thank you, everyone. Thank you, our participants, for this active participation. I encourage you all to go to the chat box. Lots of resources shared. I think it's helpful for family planning advocacy and also capacity building. Now, I also thank you all our speakers for these valuable insights. And I ask you one more minute for each one to having a summary for our today, or a message from you to our participants today. So only 1 minute, please, for each one. Who would start? Krisha? Me, Reverend, it's okay?
Yes. Thank you very much for affording me the opportunity to talk on this platform today. And I have also learned a lot, and there's a lot also that I will take to my church community and other religious leaders. And rest assured, family planning will be the subject to be discussed in my congregation and in my parish and circuit this 2025. Thank you. Have a blessed evening.
Thank you, Reverend Mkhatshwa. Krishal?
Thank you so much. Sure. Thank you so much for this opportunity to be able to share ICM's family planning initiative. In ICM, we believe that delivering the right support, right training, and right resources can improve the overall status of the people in the community. Local faith leaders can definitely partner with different government and private organizations, provide appropriate information, and use available resources to implement evidence-based family planning information. Together, we can promote family planning in our communities. Thank you.
Thank you so much, Krishal. Chicken Bakay, would you please give us
Yes.
message in 1 minute?
The message I would give, well, thank you, first of all, for inviting me to be part of this very important, interesting discussion to share our experience here in Senegal. I would like to say that I think we made a lot of progress in terms of family planning compared to before, and using solid religious arguments that nobody can say they're not valid because they are, and we're also very happy with partnerships we have established with the government, with the state, for that matter, and they have themselves recognized that our contribution has been great, in the increase of the CPR and the progress on family planning in general. We are happy to be working with the youth. This intergenerational dialogue we've established with the youth using these social media platforms are very important, and it helps really build bridges with the youth. The youth are a very, very important target for us, and we are gradually but surely, making progress in that towards that matter. Thank you.
Thank you so much, Chicken Bakay. Thank you, all our valued speakers. Now, our valued participants, please, one more thing to do before we go. Please go to your chat box. You will find a 1-question survey. You'll find 3 links. It's in the 3 languages, English, French, and Spanish. So select the link you have to go through, and then please take a couple of minutes to evaluate and have this survey for today. So we are waiting for you all to submit this survey. Yeah, in the chat box also you will find the link if you are interested in serving on the Faith Subcommittee in the conference that is planning faith participation in the International Conference on Family Planning in November 2025 in Bogota, Colombia. Please visit this link in the chat box and to learn how to sign up and more information there. Happy to have you all.